This is Neil Baum providing you with part 2 on online reputation management. And I want to talk today about managing negative reviews. Unless you're a newly minted urologist, you are going to get a negative review. It's almost like having a lawsuit or a malpractice case. You can't be in medicine for a long period of time and not get a negative review. And in the next 5 minutes, I want to share with you suggestions for controlling a negative review. When I used to receive a negative review, it would make me very defensive, and it would absolutely hurt my feelings that someone would think that I didn't do a good job, I wasn't empathetic, I didn't care, or my staff was disconnected from caring for the patients. I'd like to begin with a true story from a patient who wrote to me and stated that he had been waiting for over an hour and no one checked on him during the hour that he was in a windowless room. So I responded on the internet and stated I was very sorry about the event. It was probably a result of overbooking because I was trying to get out of town. I made a commitment that it would not happen again, and I thanked him for providing me with feedback about what was going on in my office. So what I want to point out to you that is necessary to do today is you need to check your online reputation, and you need a reasonable schedule would be once a month. I recommend that you use googlealerts.com. It is free, and it will provide you with what people are saying about you and your practice. This is an example of the Google Alerts that you set up, and you put how often you would like to hear, and every time your name appears or your practice or whatever diagnoses or whatever conditions that you want to see that appear on the internet, you will receive an alert letting you know that your name has been mentioned. I also want to point out that not only do you need to use your name as the doctor and your name, but also your name without doctor and your name with MD, because all of those can appear on the internet and you want to see them, whatever name that you want to use that should appear, you want to be able to see what people are saying. Now, usually negative reviews are non-clinical issues. Most of the patients really like their doctor and their urologist. Most of these complaints that occur on the internet are usually due, like the one I showed you, for excessive wait times. They often are concerned about staff attitudes. They may complain about parking. I even had one patient complain about out-of-date magazines in my practice. So I'm pointing out that it's not always the doctor that is the problem. So how do you manage negative reviews? You want to be sure that you make no reference to the patient, not even their diagnoses, nothing that could be construed or come back later that states that you put your laundry out on the line and allowed the public to see it. So you don't want to use any specifics about the patient's experience. You then want to make an effort to address the individuals offline. Never use the internet or one of the online review sites to discuss a question regarding your medical judgment. You might state on the, when you respond, yes, give me my office a call, as I would like to discuss this with you, and we'll arrange to speak with you at your convenience. This allows the patient to know that they have been heard and you are concerned and willing to follow up. Now, how do you handle negative reviews? Make an effort to contact the patient who is giving the negative reviews and make a genuine effort to resolve the issue. So let me give you an example in my practice. I looked on health grades and I found I had 2.5 stars. And if you look underneath the stars, you'll see I only had 9 responses. I then started to get positive reviews. When any time a patient would tell me about something positive about me or my practice, I asked them right at when they were in the office, would they go on the internet, on the online review site, and state in a written format what they had just mentioned to me. Within a short period of time, I went from 9 responses to 21. I went from 2 stars to 3.5. And then a few days later, by going up to 36 responses, I was able to get to 4 stars. This points out to you how you have an opportunity to dilute a negative response. Now, oftentimes someone will write something that is inflammatory, it is not true, and you would like to get it removed. I point out to you that you can only remove a negative review when hate speech is used, or if you can prove that the reviewer did not have the negative experience and that they were not a patient in the practice. This is very difficult and almost impossible to accomplish. You will have people calling you their rating services, and within minutes of a negative review, they will offer to load your website with positive reviews. You will get this call and they will notify you that someone has said something negative about you and your practice, and you pay for this service. They are phishing the internet to try to find negative comments about you and your practice. And I would highly recommend that this is a scam and that you should steer clear of these rating services. So what's the bottom line on negative reviews? First, don't wait for a negative review to show up before you start soliciting positive reviews. You will get a negative review at some time in your practice lifetime. And I suggest you dilute that negative review with dozens of positive reviews. If you have dozens of reviews that said you and your practice are the greatest thing since sliced bread, and one patient states that he had to wait or that there was a rude employee in your office, that will be diluted and it will have minimal or no impact on your reputation. I hope you have found this useful and helpful. If you would like more information on online reputation management and like my white paper on the subject, please don't hesitate to contact me at the email address that I have provided you at the end of this program. Thank you.